Hello, I'm happy to be present in the IVF Babble virtual Expo. Thank you for hosting us in this. I'm here in Alicante in the Clínica Vistahermosa with Dr Francisco Anaya, and we're going to talk about IVF. What are the odds of IVF working the first time around? There are many patients who are considering either risking and getting one IVF cycle on their own, or considering getting a refund guarantee program. So I'm here to talk with the doctor. What are the odds, so people can make a proper decision. So doctor, thank you for being with us today. And the webinar is of Rydia. Rydia is a provider of refund guarantee programs, but obviously we want to present to the patients an objective opinion of what are the odds of IVF? What are the chances that an IVF cycle works first time?
Yeah. Well, first of all, thank you for inviting us to come to the IVF Babble. And about that question, I think it's a very difficult question because it depends on many things. It depends on the age of the couple that is coming, on the quality of the eggs, on the quality of the sperm, on many questions which makes very difficult to answer that question directly. But couples must know, because sometimes when they come to our clinic, they think that with IVF everything is going to be successful and it's easy, and it's not like that. Sometimes we have to explain them that IVF is not such a fantastic technique and has its percentage of success, but it's not 100%. We have to say that.
You give me some examples of percentages,
Yeah.
Depending on age, for example.
Yeah, for example, IVF in general has a success rate of 40% or something like that, depending on the age. When the older the woman is, the success rate is going to decrease much. So over 40, for example, we are about 30% of success, not more than that. So we have to consider that.
So that means that out of the 70% chances not to succeed. So this couple will going to pay more and do another cycle and another cycle. Okay. So how many rounds of IVF on average you will see that a couple will need until they reach a success?
On average, not considering the age, maybe we could talk about minimum 1.8 or two cycles.
2 cycles minimum.
So yeah.
So when couples come for a first consultation with you, do you share these statistics with them? I mean, what
we try to share this.
So let's take a case, for example, of a couple that is in 35, 37, and they have what is called unidentified infertility. So they're healthy, they don't have a specific problem, so they don't know what's going on. Sometimes they find out, you doctors say, we cannot identify, it's an infertility issue, but we don't know. What is the average percentage of such a couple?
Well, this kind of couples is the ones that I told you before, that they used to think that with IVF everything is going to be easy and they're going to have the pregnancy in the first attempt, and we have to explain them that it's not so easy. The fact that we don't find a special cause of the infertility doesn't mean that it's going to be easy. Sometimes we find after that the quality of the eggs is not such good as we thought before, or some other problems. So on average, I think that it's not going to be one cycle, maybe 2 cycles, or sometimes more. So we have to explain them. We always explain them the pregnancy guarantee program, because we think that it's very interesting, because they cover the treatments, all what they need. It covers their medication also, and if they get pregnant, everyone is happy, and if they don't get pregnant, they get a refund of the money. So it's very interesting for them.
So yeah, it's a way to secure themselves, because as we discussed, success is not guaranteed, and the success rates are not. If they're lucky to be in the 30% and be first time, but nobody knows. So the refund guarantee program offers them a security that at least they, like in insurance, they know how much they pay. So going into the elements, if you like, let's discuss more like your medical issues. What will be the elements that will improve success? Well, what are the things like quality of the embryo, the endometrium lining? What are the elements that you want to see to increase the success rates?
Well, the ideal couple to increase the success rate, I think it's a young woman, a young man also, if it's possible, with a good ovarian reserve, with a good anti-malarial hormone, with good quality eggs and good quality sperm. We used to study also the sperm sometimes with the special test of the sperm, like fish test or fermentation, which is very important because with abnormal fish, which is chromosomal abnormalities in the sperm, we find very poor embryo development. So with normal tests of the sperm and a normal uterus, that would be the ideal couple.
How do you define normal uterus?
With no myomas or a good endometrium.
Do you have like a lining minimum of 8 millimeters lining or 7?
Not minimum. We like the line be over 7 millimeters, but sometimes there's some special people that doesn't arrive to 7 and it's not. I think that's also important.
Right. Do you think other elements in the health, well-being, BMI, for example, the weight of the woman?
Of course. There are many other elements that can influence. But
what about the men? What weight affects the sperm also?
Yeah, I think so. Not if it's very overweight, it affects the sperm. And also kind of life. So if he smokes or not smokes, alcohol and many other things that can influence the sperm. The age also. We think that sometimes we think that the age of the man is not so important, but it is important.
But it is important. So what is the age of the man that you see that it tend more to have abnormal sperm?
Well, I think over 40 it gets worse, and over 50 it gets much worse.
Right. Right. Do you suggest, like, if a couple that is watching and considering an IVF cycle, if despite the fact whether they choose one cycle or a refund guarantee program, would you advise before they start IVF to get? There are many vitamins and many things that people suggest for fertility that they will improve. Do you think this is a good thing, and do you think there's worth taking for 2-3 months these vitamins and pills?
Sometimes they can help, but many of the things that are offered today don't have really some studies backwards that really demonstrate their improvement. So they can help sometimes, but it's not a definitive. I think it's not so important. We use them sometimes, but always saying that it's a little help, not something that is going to change everything.
Yeah, it's interesting that you spoke about the sperm, because there are many women who felt that they are to blame, and there's some psychological burden for them when they cannot conceive, and they go to IVF. Perhaps they have a failed IVF, and they get all the blame, but as we said before, 50% of success is on the male factor, correct?
Yeah, of course. Yeah.
So it's both there going, and it may be and identify infertility in the women, and maybe the quality of the eggs are not so good, but then we may have a serious sperm factor that is not obvious with the semen analysis, right?
Sometimes we have to do what I told you before, some special tests about the sperm, which are very important for us in order to consider the success rate for this couple. We must complete all the studies. some years ago we just had the sperm test and it was all, but today we can do a fermentation test or a fish test, which are very important in order to see how it's going to be the cycle and how it's going to develop the embryo.
So this actual test, I mean, what I know, I'm not a doctor, explain me in a medical way, it actually studies the DNA and see whether the DNA is able to produce a healthy embryo, right?
That's it, because you have to consider that some of the embryos that we're going to get in an IVF cycle are not chromosomically normal. And it increases the rate of abnormal embryos increases with the age of the woman and with the age of the man. So we have to study, we would like to study also the eggs, but it's not possible nowadays, but we have to study the semen in order to see that the chance of getting healthy embryos is real. When we study the embryos with the PGT-A, we see that, for example, in couples over 40 years old, more than 50% of the embryos are not normal, are not euploid, so we cannot transfer them, and that makes more difficult the chance of having a healthy baby at home, which is the objective of all these treatments.
So we see that there are two levels. One level is testing the semen, and I think there are, if we find, for example, a higher fragmentation, there are also some special methods that I don't know how the name of it. Some call it fertility chips, some call it a different name, but you select actually the good sperm that is not fragmented, right? So it's if we do the proper investigation to the sperm, we can act to do something before we do PGT-A, and the PGT-A is the next step. That we do the. Explain these two methods, please.
Like two different things. When we find high fermentation, we used to do the MAX, the annexing columns test, in order to select the best sperm to perform the IVF. And that's one of the steps. Okay. Another step is when we find an alterated fish test, or we have a woman over 40 years old, we suggest the PGT-A, which is once we have the embryo, analyze it before transferring, in order to transfer only the euploid embryos, the healthy embryos. Okay. There are two different steps. One is much more simple, which is the fragmentation and the MAX, and the PGT-A is something quite more difficult to do. Technically, it's more complicated.
Yeah, but you can find whether the embryo, if we find euploid embryos, that means, for people who don't know what euploid means, we mean DNA healthy. So they are embryos that have potential to grow into healthy babies. Does this really increase the success rate?
Once we have an euploid embryo, the success rate is very high. Once we get it, the difficult thing is sometimes getting it. But once we have it, it increases our chances of success are much higher.
So when you have a consultation with a couple and you have the history and they have one or two IVF cycles, how do you study the history and see what can you do different to succeed?
First of all, we try to perform all the tests. Sometimes they haven't done before, because when we see an infertility without any cause, we have to think that there is a cause, that we haven't found it. So we try to complete all the study if there's any test they haven't done before, and after we have to think about what things have failed in the previous treatments and what can we do to improve them. So it's what we have to speak to the couple about all what has happened before and see how we think that we can improve it. But we have always we try to improve everything, but when an IVF has gone bad twice, we have to think that it's difficult to change everything in the third one. So I always think that with people with another clinics that are very good also, and they have tried twice and they haven't encourage. Sometimes we should think that it's going to be difficult also in the third attempt.
What do you think? There's an area that's called immunology, and there are. I know this is debated. Some doctors believe it, some don't believe it. There's a debate in the medical community. What do you think about the killer cells? Is it real? Is it just for marketing, or does it affect really? I mean, can it be that everything is perfect and there are killer cells there, and that's why it's failed?
My personal opinion is that it affects, but it's not. It's a bit of marketing and a bit of real. I think that it cannot be the only cause of infertility, but I think that if you control it, you're probably getting more chances of success. So it's something we take in account, but I don't think it's the main factor of anything. We used to study killer cells, and we used to treat them sometimes with steroids, sometimes with other treatments.
Intralípidos?
With intralipids, sometimes we use them, but I think it's not the main cause of infertility. I think there are helping points.
Right. What do you think about the psychological element? And one thing that the refund guarantee program that we offer is to take out the stress from women. So that we know, as we discussed, that nobody can guarantee success rate. First time is very small, so it's really a value added for them, a security financially, but it's also psychologically, because there's a lot of stresses. Can I succeed? And getting into one, and getting a negative test, and trying more, and it's psychologically draining. Do you think that the psychology also affects the success rate?
Yeah, I think so. And we have to explain also to the couple that this is not just one. Even if they take the guarantee program or not, it's not just one treatment thing. We are going to take them to have a healthy embryo, a healthy baby. And it's not just one treatment. Sometimes we have to explain to them that it's a long way. Sometimes we get it in the first, and sometimes we get it in the third. But they have not to psychologically think that it's going to be just one treatment and they're going to be pregnant. So in the first couple of consultations, we have to explain them that maybe it's going to be a long way. We're going to be with them sometimes for a year or more, and we will get it finally, but sometimes it's not as we would like, all of us, that would be the first one. Sometimes it's the second or the third, or another treatment, some different that we started. So I think psychologically that helps the couple not to put all the hopes in the first attempt, just to be more relaxed. And I think the guarantee program helps that also, because they know that maybe it's in the first attempt, maybe it's second, but the clinic is going to do all they can to help them.
No, and also in addition, we give them options. For example, we have a program that even older ages like 40, 41, 42 can get into it, and they can try one cycle with their own eggs, knowing that the success rates are low, but at least they can have a last time try, having also PGTA, and if not, they have an option in the second cycle, they go to egg donation. So that breaks the barrier, of course, that I have no option, I hit my limit. Obviously, there can be the egg donation option. Yeah.
That kind of program helps me very much, because sometimes the couple is I suggest them to go into egg donation, but it's their first treatment, and they don't want really to do it. So it's a nice way of giving them an attempt. Sometimes it's just to realize that it's not possible in that way. They go through it, they realize that it's not their best treatment, and then they consider the egg donation that was not at the beginning. So that's a very nice program. It helps me much because they attempt, they try it, they see it's not possible, and then they go more convinced into a donation program.
Yeah, and talk about the cost. If we are, because we are transparent, we can see that a cost of an IVF cycle, for example, here in Vistahermosa, because we cannot talk about other clinics, is how much on average?
Yeah, it's about, I think an IVF is about 4,500 euros.
4,500. If you add medication, another 1,500. If you add frozen transfers, if you have embryos and the dose succeeds per time, it can easily be a cost of around 7,000 euros. And the program, but if you need to go for a donation, that can go even higher numbers, 8,000 and 9,000 euros per cycle. And so the program offers them 3 cycles of all this all together, which is an average cost of at least 25 to 30,000 euros for much less. So they have a package that they pay depending on the treatment. If they, it can be start from 16,500 if it's pure egg donation. It can be lower if it's only IVF. It can be about 20 something thousand if there is combination between IVF and egg donation. But they get much more than they pay for, and they get the security and the life birth guarantee, right? Yeah. So they take the financial strength. So many couples, according to your experience, couples who come for consultation, they are stressed about the money.
Yeah. Yeah. Yeah, and it also includes, as you said, the medication, are all the extra techniques like time-lapse systems or max or everything we need to do with the couple. I think
and these are extra. If they come without the program, they have to keep on paying this extra, right?
Yeah, of course. So I think that it's going to be a big amount of money at the beginning. That's real. So they have to pay maybe 20,000 or something like that. But they finish with that. They don't have to pay anymore. The medication is included, everything is included, and they are going to get a pregnancy or a refund of their money. So it's very clear for them, and as you said before, the stress for the couple, the economical stress, just pass once, and they are not feeling that they are paying more and more and more. They just pay at the beginning and finish with everything. I think it's very interesting.
Okay, now coming to the end of this nice discussion, because we are in Spain, obviously. I know Radia works with many countries, but Spain is a very popular location, particularly for UK patients, but also from patients from other countries around the world, not only Europe. We have patients from all over the world. What is the current situation with COVID and the travel restriction? I mean, how? What do you see is happening? Because you see patients every day. Are they stressed about being able to travel to Spain? What is the situation?
Some months ago, we had very lot of restrictions when we were in the beginning of the pandemic. But nowadays in Spain, our situation is complicated, like many countries, like UK. But we have now no restrictions coming here. It's just the quarantine they have to do when they come back to their countries. But here they can travel in a secure way. We have all the measures that we need to have in order to make these treatments as secure as possible. We perform a COVID test, a PCR, before the treatment, and we do it in a very, I think, almost normal for us. Yeah, we've been through this the last 6 months, and it's safe coming here and do the treatment now. It's not a problem.
And I think here in Alicante is the safest area and the lowest cases in Spain, right?
Yes, now is the safest area in Spain. Yeah.
But coming back to this, maybe this is also a good in disguise, because they will do the transfer. They go back to the UK, they have quarantine, so can relax for 2 weeks. Will this affect success? if they relax and they don't have a busy life?
Maybe, yeah. We always recommend to have a relaxed life until the pregnancy test, yeah. So
it fits very well together, yeah.
I haven't thought about it.
Okay. I don't know if you have anything else to add for our patients that are watching.
Well, no, I hope they connect on the 4th of October and we can continue discussing any doubt or any question they have.
Well, Dr. Anaya, thank you very much.
Mm-hmm.
I think IVF Babble again, Rydia is ready to assist anybody who's looking for a refund guarantee program. So I will be available now after the end of this broadcast for questions on the online chat of IVF Babble. So I'm happy to answer any questions you may have, and also all the clinic here and the doctor and all the clinics we work with are open to answer questions that anybody have, as complicated as they are. Thank you very much for watching this broadcast.